It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everybody, and welcome to another live round of Katz's Corner here on WABC. I'm your host today, Dr. Philippa Cheetham. We've got a great show for you. Unfortunately, my co-host and number one colleague, Dr. Aaron Katz, is snowed in upstate, and I believe he's in the kitchen sipping tea, listening to what we're saying. So hopefully we'll be on our best behaviour, and we have got a great show for you today. And last week I was down in the Bahamas with Steve Cionti doing prostate HIFU, and it's certainly much chillier here. I was waking up putting on scrubs with palm trees around me, but not this week. It's certainly nippy and chilly out there today. And please give us a call if you want to ring into the studio. Give us a call on 1-800-848-WABC. That's 1-800-848-9222. Lots of people tend to call in towards the end of the show when Dr. Katz and I are trying to run out to get breakfast. And when we've gone off the air, we get asked by Mike to come in and talk to people about questions. So get in early. We are here, 1-800-848-9222. Now, February is Cancer Prevention Month, and believe it or not, 1 out of 2 men will be diagnosed with some form of cancer. 1 out of 3 women will be diagnosed with some form of cancer, and 1 out of 4 Americans will lose their life to cancer. And believe it or not, more than 50% of all these cancers are preventable. As doctors, we tend to focus on things when they're broken. We learn at medical school how to treat diseases, but still, many years later, we are still not really focusing on prevention as much as we should do. And just to kick off the show, I would like to introduce one of our guests who's actually calling in on the telephone this morning. We do have a guest in the studio as well, but I'd like to introduce you to Dr. Margaret Cuomo, who has written a fantastic book called A World Without Cancer, The Making of a New Cure and the Real Promise of Prevention. And Margaret's going to tell us a little bit about her book. Good morning, Margaret.
Good morning, Philippa. Thank you so much for welcoming me this morning. And yes, A World Without Cancer is my personal journey with cancer as a physician, a diagnostic radiologist, experiencing cancer's horrific effects on the lives of my family, friends, and patients. And as you just said so well, we can prevent cancer, but actually cancer is the most feared disease statistically. And part of that fear is based on the feeling we have that we have no control over it. But yes, we do have control, and cancer can be prevented, over 50% of it, by attention to diet, exercise, limiting alcohol, ending smoking, protecting our skin from the sun, and taking vitamin D. These are all ways that we can lead a cancer-free life.
Now, Margaret, I know that you're a Board Certified Radiologist and working in New York, and also as your father is former New York Governor Mario Cuomo, and you have two brothers, Andrew Cuomo and ABC's Chris Cuomo. Tell us what gave you the incentive to write this book.
Absolutely. And I just want to mention on that note, yes, I have a legacy of public service, mother and father, and my brother Andrew is doing a fantastic job. I hope and feel people are thinking.
I hope your brother's supporting your book.
He certainly is. And my brother, as I just wanted to mention, just moved to CNN as their new morning anchor. But my incentive is that I had observed the cancer culture for many years, and we are too focused, as we know, on treatment, and we dedicate too much of our research funding almost to the exclusion of any preventive strategies. As we know, over 50% can be prevented with what we know right now, but imagine what we could do if we dedicated more research and energy to the prevention of cancer.
And I think there's this ongoing problem, isn't there, that trying to address preventative issues and education with the patient in the office in particular, it's often a factor that's very difficult for doctors to address when we're so busy, and it takes time to educate people as well. And I think that there's certainly this deterrent with the lack of reimbursement for a wide range of interventions that can aid not just in cancer prevention, but in other preventions. I know Dr. Katz is very proactive at talking about prevention and education and what we can do to prevent disease. But I think there's this big problem in the profession where prevention education takes time in the clinic that we often don't have.
Yes, we have to elevate, Philippa, we have to elevate the status we give to the prevention of cancer. And we do that by rewarding doctors, by acknowledging their time and effort, reimbursing them for it, certainly, but also training them in it, in medical schools, dedicating more training to the prevention of cancer. We can't have our physicians uneducated and ignorant about how to speak to their patients about the prevention of cancer and other chronic diseases. What prevents cancer will also prevent heart disease and diabetes. So it's 3 for the price of 1.
That's right. And I actually saw a television show this week with our good friend Gabe Canales, who's the founder of the Blue Cure Foundation, talking about how we need to focus on the chemicals in our diet, the chemicals in our food, environmental factors and stress management that can significantly reduce your risk of getting cancer, but also to allow those people that have cancer to have a better outcome if you're going through conventional treatment.
That's right. Blue Cure and Gabe Canales is on the cutting edge, educating young men and boys in particular. We focus a lot of attention on female cancer, but also boys and young men have to know how to handle themselves, how to lead their lives in a cancer-free way. So, yes, Cancer Prevention Month is this month, February, and I urge everyone to focus on cancer prevention. There's a lot of information in my book, A World Without Cancer. You can find much more on the Internet. Go to bluecure.org. And I hope that we will make strides as a nation because we desperately need to increase the health of all Americans.
Well, thank you so much, Margaret, for calling in, and I very much look forward to interviewing you with Dr. Katz on a dedicated segment of Katz's Corner. Thank you so much. Good luck with the book, and congratulations. That was Dr. Margaret Cuomo talking about her new book, A World Without Cancer. And I think the time is now for the establishment of cancer prevention education in American medical schools, and this is going to make a significant difference in the quality of life of millions of Americans, and the work that people like Dr. Margaret Cuomo are doing and Gabe Canales from Blue Cure. This really is the way forward, and I'd like to thank Dr. Katz for educating me so much about cancer prevention, and thanks for calling in, Margaret.
Thank you. Have a good day.
Thanks very much. And in the studio with me, I have Dr. Ernest Patti. And Dr. Ernest Patti is Senior Attending Physician of Emergency Medicine at St. Barnabas Hospital in the Bronx. And we've been talking there briefly with Margaret about cancer prevention. At the other end of the spectrum, we have an emergency room doctor sitting in the studio. And in my experience, the ER docs always have the funniest stories at dinner parties. Good morning, Ernie.
Good morning, Philippa. Thank you very much for having me. I really appreciate it.
Thank you. And you've been busy the last few weeks with the crazy flu season, I understand.
Oh, influenza has been keeping us hopping. Yes, very busy.
And what's the state of play right now?
Well, right now it seems to have leveled off. We've been running 20 to 25% over our usual volume, which has really stressed and strained the facilities at the hospital. But we have certain plans in place that we activate, and everyone rises to the occasion during times like this to really work over 100%.
And it's not just the fact that the flu patients are coming in and taking up the beds. It's the fact that all these other patients who have medical problems are being delayed, and it's a huge strain on resources, isn't it?
Oh, of course it is. Of course it is. You know, just because we have all these flu cases doesn't mean that the usual traumas and other injuries and illnesses don't come in. They come in, and they come even in greater numbers due to the fact that the weather's cold and the temperature has been fluctuating quite crazily over the past few days. Actually, the past week. Excuse me. So it really puts puts a high demand on the ability for us to care for these patients.
And an even bigger strain, I guess, when you're running off to Fox Television to talk to Megyn Kelly about the flu and other subjects that I know you cover quite frequently.
Yes, but that's all in the name of education. Come on, you know that.
Absolutely. Now, one of the reasons why I wanted to bring you into the studio is that, as you know, Dr. Katz and I talk a lot about men's health issues and cancer-related issues. When people come to the emergency room, let's just talk about some of these questions, because you were telling me yesterday that you actually get asked quite a lot of men's health issues in the emergency room. And one thinks that people go to the emergency room, obviously, for emergency treatment. In the UK, as you know, we call the ER the accident and emergency room.
Yeah.
And often when people come in, the first thing we ask them is this an accident or an emergency? And if not, you need to be somewhere else. And again, that can also put a huge strain on the system when people are coming in for non-accident, non-emergency problems. Tell us some of the questions that you get asked and describe a little bit about the kind of things that you're seeing at the moment.
Sure. Well, on a daily basis, first let me just agree with what you said there. You know, you would think emergency departments would be treating acute care, but many times we get patients who come in with chronic complaints, and many times we actually get patients who come in for a second opinion. They basically want another healthcare professional to tell them, yes, what the first doctor told me is such and such. So I have men and women both coming in quite frequently, but they come in with questions related to, you know, the usual lumps, bumps, things like that, but also questions regarding changes in their body habits, such as urination, difficulties with sexual function, and many things like that. And they'll come in, and if they feel comfortable with the physician that they're speaking to, they'll open up their heart and pour out what's going on and say, look, you know, I'm on these new medications for blood pressure, and it's really affecting my libido. How do I cure this, or how do I change this? And many times it's just informational. You know, I have the beauty of having a small amount of time in that interaction with the patient in which to make a huge difference in either A, educating them, or B, actually helping them look for ways to prevent things from worsening, including a lot of cancer-related issues.
Hold it there, Ernie. You're listening to me, Dr. Philippa Cheetham, on Katz's Corner. We're live in the studio and the phone lines are hotting up. We'll be back with you shortly, Ernie, to ask some more about what's been going on in the emergency room. Let's take a call from Faye in Brooklyn. Good morning, Faye.
Good morning, Dr. Cheetham. I must tell you that you have been a tremendous help in the care of my father with Dr. Petrolak. He recently passed away December the 15th. But I must tell you, this was not by chance that I called in this morning. I just happened to wake up, and I have listened to you in the past on the radio, and I bought Dr. Katz's book, trying to find ways of helping my father. But basically, my father had actually been very serious about his preventative care. I mean, he was told 10 years ago to check back with the doctors about his prostate, and he just sort of made nothing of it. And my mother was constantly pestering him about checking it, you know, further. He would have probably, I mean, who's to say? I mean, God is in control, but he could have helped himself possibly. And but the fact is, it went further than we could handle. But Dr. Cheetham, you have been a tremendous help to our family, and actually to me specifically. I've called you about other things, and thank you so much.
Well, thank you very much for your kind words, Faye. And I know that you have been the most caring daughter, and I'm very sorry to hear the news about your father. Thank you for calling in to Katz's Corner, and Dr. Katz and I send our best wishes and condolences to your family. Thank you very much for your support. And as doctors, we give a lot of information to patients and we educate our patients, but I learn a huge amount from listening to my patients, and you've certainly educated me on the importance of the way we care for patients. And thank you very much for your call.
Thank you.
Ernie, very interesting comments there as well about what Faye was saying about the importance of the daughters and the wives in helping with cancer prevention and education. So often men with prostate cancer, it's the wife that reaches out to me. They will often call up and say, I've heard about this new treatment. What do you think about that? They're very, very proactive. And the spouse is so important in dealing with medical conditions. Oh,
sure. The support system from the family, especially the spouse, is huge. Many men are in denial. that this can't happen to me. I'm rough and sturdy and, a former construction worker. Nothing like this is ever going to affect my body. And basically, they live in denial until the sad truth hits them that, it may be far too gone. So the real important thing is to have the family support. And today it's quite easy with the Internet. People are out there, and they come in to visit me, and I'm sure they do this in your practice as well, armed with a fistful of information, sometimes the right information, other times it may be a little scattered, but that helps them come to you with a lot more questions, which hopefully educates the entire family and support system.
I mean, I definitely think there's been a change, hasn't there, in education, and patients now are much more proactive than they used to be. They come in, like you say, asking a lot of questions. Certainly the Internet helps a huge amount, but also it can frighten people and sometimes cause more confusion when you see 25 different potential diagnoses when they look at the symptom of, say, blood in the urine, for example.
Sure.
Talk to me a little bit about education in the emergency room. I mean, last night you were telling me that people often come in asking questions about whether they need a colonoscopy, asking about diet. How do you deal with these questions in a busy ER? Do you have time to talk to people and educate them about prevention?
You always try to make time, and it's difficult sometimes when you're in the middle of 2 or 3 traumas and you have a patient who wants to know, why do you need to do this rectal exam on me before I leave? And why are you scheduling me to see the gastroenterologist for a colonoscopy? But you do try to take time. We do have a lot of printed literature that we try to hand out and at the same time point out what's important in it. But really what I do many times is the patients themselves are not really listening to you that carefully, because many times being in the emergency department is so loud and so busy. Patients, they can't process everything. So just like you said earlier, it's important to reach out to the family members that are with them and try to grab them into your sphere. And many times I'll grab the daughters, the sons, the spouses, and I'll say to them, this is what I want you to remember. And I'll give them the 3 or 4 important highlights for follow-up and also for prevention strategies. Diet changes are key. Taking vitamins is key. Proper exercise is key. All of these things. And many times I'll hit them quick and hard and try to give it to them. And it's not unusual for me to call patients up. Even though I'm an emergency physician, I take their demographic information, and sometimes 2 or 3 days later I'll call and say, did you go for that test? Are you doing what I told you to do? Remember me? And it's quite interesting. The positive response I get from a lot of people is amazing.
Well, that's fantastic. You must see a lot of problems as well. I know that you're practicing up in the Bronx area, and I'm sure the kind of patients that you're seeing there is probably quite different to what we're seeing in other parts of New York City. Oh,
it definitely is. I work in an area where many people turn to us for their primary care. They don't have access to primary care physicians. The waits at the local clinics and the primary care physicians' offices are very long. So they come into the emergency department and they want to see us and they want to do everything in one visit, which is very difficult. We try to get them into our clinic system or at least hook them up with a primary care physician. But many times it's just education. Or, you know how many times I've sat with a mom and tried to show them the proper way to feed their infant rather than overfeeding them and then bringing the baby in at 3 a.m. for vomiting, which is really just that they're overfeeding them. And these are things, simple things that you can help them with. Maybe they're here on their own and they don't have extended family, where you and I, growing up in a family where our grandmothers and our parents and our relatives could give us support. A lot of people here don't have that network.
We're talking a lot here as well about diet, lifestyle in terms of heart prevention, heart disease prevention, cancer prevention, and certainly a heart healthy diet is a prostate healthy diet. We talk a lot about the diet that is good for your prostate health. You're in the emergency room, you're seeing people come in with chest pain, they're concerned that they may be having a heart attack, they may well be having a heart attack. How do you address these issues of changing diet, lifestyle? Do you believe that that's your role? Do you believe that's the role of the cardiologist? How do you actually increase awareness and change views?
I believe that it's very important to, you can't just say it's the cardiologist. It's everyone's job. Everyone who's a physician today, physician and surgeon, has to get involved and be invested in this 100%. I start the process. You have to do it delicately. You can't berate somebody when they come in for poor lifestyle choices or poor diet choices. You want to be supportive, yet at the same time you want to point out ways in which they can start and make a change, because every change is going to help. You have to make small changes. You can't tell the guy who's 350 pounds you need to lose 150 pounds overnight. It's not going to happen. But what I do is try to show them and say, look, if you make small changes like this in your diet, get rid of some of that fast food, get rid of the regular soda pop that you're drinking every day. Things like this. Quit the smoking, or at least try to decrease to a point where you can quit. Cut out a lot of that alcohol. These are things, and don't take the elevators at work. Maybe walk the steps, 1 flight a day. Increase over 3-4 months. Simple changes that in the long run are going to make a tremendous effect on your body.
Do you think people are more likely to tune into these messages when they're unwell, and that they're focused much more on what's going on with their body? They're focused a bit more on addressing these things? Or do you think people are too scared and too worried about the acute situation to take on board those messages?
I think you have a little bit of both. I think some of them really do. It does hit home with some of them, and I've had people come back and say they've made changes after that scare in the emergency department where they've had the chest pain and we thought they were having an MI. Others are afraid a little bit about it. But the other important thing is you have to set a good example. And, I try to keep fit. I can't be an out-of-shape doctor who's smoking cigarettes outside the emergency department and then go in and tell my patients you can't be doing this.
Sure, it's amazing how many vascular surgeons you see smoking, and they spend their life dealing with legs where blood supply has been impaired from smoking.
It's such a truth.
I mean, we have to set an example. Just wanted to talk about what you learnt at medical school in terms of preventative medicine. I mean, certainly in my training, it was a very neglected specialty. You have medical students coming through the ER, as we do, coming through our department, and we try and focus on education.
Definitely. Well,
it's lacking, though, isn't it?
Oh, it's definitely lacking. And I had the beauty of spending some time in your home country as well, doing some of my medical training, which was a great eye-opening experience. Learned wonderful physical diagnosis. Here in this country, I've also studied in osteopathic medicine, and osteopathic medicine afforded me a stronger foundation in nutrition, physical activity, the importance of stretching and exercise. And these are modalities that we sort of ignore them today in our high-tech, high-stress lifestyle. So I feel, though, it's still very important and needs to be stressed. And the other important thing is the way in which you communicate with your patients. Some people are born communicators, and they have a relationship, and they can make people feel warm and bring them into their sphere of care. But there are many, many physicians out there who are just brilliant, but cannot get across the barriers to connect with those patients. In my field of work, I have sometimes up to a minute in which to make an emotional connection with my patient. If I'm successful at it, it's going to be a good patient interaction regardless of the disease entity. But if I'm not successful at it, then I lose the patient and maybe can't educate them as well for prevention strategies.
You're listening to me. It's Dr. Philippa Cheetham. It's 7:24 in the morning on Katz's Corner. I'm live here with Dr. Ernest Patti from the emergency room in the Bronx. Let's take a call, Ernie, from John in Staten Island. John's got a question for us. Good morning, John.
Good morning, John.
Okay, good morning. You've got a great guest, and of course, it's a great show. And you'll be surprised. There are men out there, even listening now, that don't even know what a prostate is.
I certainly know that, and many times I often get asked if women have a prostate. And there was an article, actually, John, yesterday that my mother was telling me about in the UK that was talking about women suffering from prostate cancer. And the article was trying to tell people that women are affected when their husbands, brothers, sons, fathers have prostate cancer.
Sure.
But my dad did ask the question, do women have a prostate? So, and he's been a regular listener to Katz's Corner. So, Dad, no, women don't have a prostate. What's your question, John?
Right, but men can get breast cancer. Women can't get prostate cancer. Here it is. I think we should be further along in the research for cancer. I really believe we should emphasize more in the universities, get the more brilliant kids out there involved in the research. And we are the wealthiest country in the world. We should be further along in this cancer research and cure.
I totally agree. And as Margaret has written about in her book, research shows, John, that we can prevent half of all cancers with what we know right now. Yet the National Cancer Institute will spend $3.3 billion this year on research designed to understand and treat cancer, and yet only $232 million on cancer prevention. Yeah. Ernie, comments?
I'd love to say I agree with you, John. It's very important for the research, but a lot of times patients need to take a little bit of this energy themselves and use more common sense when it comes to their daily lifestyle habits. I mean, this is key as well, right? You know, you need to eat proper. You need to exercise. No one ever died from over-exercising, or at least as far as I know, and no one ever died from eating too much broccoli and vegetables. You know, these are things that we need to really instill in our youth so that people follow these good, healthy habits through their lifestyle to increase their lifespan and help in the prevention strategies, you know?
It also amazes me that there's so much information out there about things like smoking causing lung cancer and smoking and heart disease. But all these factors in the diet, in the lifestyle, there's so many messages that do not come out. For example, we know that smoking is the number one cause of bladder cancer.
Sure.
We know that all these dietary factors are increasing the incidence of diabetes. We're seeing so many young children now who are overweight.
Definitely.
But it's so difficult sometimes to get this message out. And you hear as well people saying, but it's so difficult to eat healthily, to buy food that's healthy, it costs more money. What do you think about that?
In areas like where I work in the Bronx, yeah, of course, it's much easier to feed a family of 3 children with fast food. You can spend a lot less money rather than trying to go find a place where you can buy some fresh fish and some fresh vegetables and make them a healthy dinner. It's very difficult for these people, and a lot of times big business makes it harder for patients to live a healthier life when there's so many other unhealthy choices out there for us.
Where do you think we're going with Obamacare? Do you think this is going to affect patients being able to get access to doctors?
I definitely think it will. In areas like ours, it's going to be a little harder to reach primary care physicians. You know, you have to understand that in certain the same recipe doesn't fit for all parts of the United States. And we're going to have to really focus on areas with high concentrations of people who don't have primary care physicians or GPs. That's the start. You need to have a good GP that's available that you can get in to see when you need to see him.
Okay, let's take a final call from Bob in Bergen County. We are off the air at 7:30 on the dot. So, Bob, give us a quick 30-second summary of your question.
Okay, I have a question about neurogenic bladder.
Sure.
I have multiple sclerosis, had it for about 25 years. It's a mild case, but I do have a problem with my bladder. I'm retiring now, and I'd like to be able to be more spontaneous. Previously, when I was working, I had a predictable routine, and I'm wondering if there are holistic treatments or anything, because the only doctors I've gone to have always just given me a prescription.
Okay, thanks very much for your call, Bob. I will definitely come and follow up with you at the end of the show, so stay on the line and we'll talk a little bit more. Bob there talking about neurogenic bladder, where the bladder is affected by neurological problems. There's a whole load of investigations that we can do to look into that. Certainly there are some holistic treatments, and I'll come and talk to you. I just want to thank Dr. Ernest Patti very much for coming on to Katz's Corner. You've been a great guest, Ernie. Love to have you back. And I know that you've also had a personal experience of cancer yourself, which I'm sure is relevant in how you talk to patients as being a patient and a doctor.
Most definitely, Philippa. Thank you for having me. Yes, I'm 15 years clean now. I had a scare with thyroid cancer many years ago, and it really opened my eyes and made me that much more understanding that, it's the need to train patients and to help them realize prevention strategies is key. It really made me even a more compassionate physician than I am.
There's no stronger lesson than being a doctor who becomes a patient either, is there? And you suddenly realise that you want to practice medicine the way you would want to be treated, and we mustn't forget that.
That's 100% right. Once you go under the knife, you get a whole new understanding. So
what's the day got in store for you? Are you back to the ER today?
No. Today I happen to be off, but I'm sure I'll call in to find out what exciting things are going on today. So I'm going to spend some time with my family.
Well, thanks very much for being on Katz's Corner, and of course, Dr. Katz will be back with us in the studio next week. Hopefully by then the snow will have melted and we'll be back on Katz's Corner, and we hope to focus February on cancer prevention. So if you have a question, then be ready to call in next week at 1-800-848-WABC. That's 1-800-848-9222. We're here every week live on Katz's Corner, so if you have a question for us, give us a call, and you can always pick up the podcast on wabcradio.com. This is Dr. Philippa Cheetham on Katz's Corner.